Hi everybody, it's Dr. Mike coming to you from beautiful West Newbury, Massachusetts. Hope you all had a nice holiday weekend. I wanted to do another entry on the video blog and this time answer a question that I just got from a reader in Canada who asks about potential treatments for her 2-year-old son. And the question goes something like this. A number of folks that she knows with kids of similar ages have been prescribed Zoloft for potential improvements in language. However, her son doesn't have any significant anxiety or other symptoms that might warrant treatment with Zoloft. So she's wondering if giving a medication like Zoloft in the absence of any of these target symptoms might actually help with language all by itself specifically. And I've heard this theory espoused in a number of ways, and it really is just an extension of clinical observations. For example, a lot of people who have seizures that are treated with Depakote get improvement in their cognitive function and overall functional capacity when the treatment with Depakote stops their seizures. So the extension of this line of reasoning would say that you just treat everybody with Depakote, then you'll get an increase in their functioning, even if they don't have seizures. Now, logically, there's a couple of problems with that argument, and most importantly, it's that there is an intermediate step that you're missing. There's no reason to suppose that the medication itself is directly improving your cognitive function or any other specific function, language function, social function, if it's actually relieving some major symptoms, and if it's possible that those major symptoms might be causing the functional limitations. So in the case of somebody with severe anxiety and a lot of repetitive obsessive compulsive symptoms and social problems, well, you can imagine that somebody who's in that state is going to have poor social functioning and poor language functioning. And so treatment with an anti-anxiety drug, or anxiolytic drug, as we would call it in the trade, like Zoloft or any of the other SSRIs, would decrease the anxiety significantly, and it typically does. These medications are very effective in that regard. So in decreasing the anxiety, you would relieve one of the major functional limitations and allow for enhanced function overall. But that's not to say that Zoloft improves language function. And it's not to say that Zoloft is going to improve language abilities in someone who doesn't have significant anxiety. In fact, someone who doesn't have significant anxiety will probably already have better language on average. Now, at 2 years of age, you would expect that most males with Fragile X wouldn't have very good language development anyway. But if anxiety is not the limiting factor, then relieving anxiety with a medication like Zoloft, sertraline, would not necessarily do anything to help the situation. The same with Depakote. If seizures are causing a problem and they're essentially having a toxic effect on the brain, and it's well known that they do that, then relieving those seizures, suppressing the seizure activity, should result in some functional improvements. Now, it all depends on how often the seizures occur. If you have a seizure once a year, it's probably not worth taking an anticonvulsant just to suppress that level of seizure activity, because the anticonvulsants themselves cause some cognitive impairment. And that's the other side of this argument, is that you're giving drugs in either case, whether it's a fairly nasty drug like Depakote or a fairly benign drug like Zoloft, sertraline, you're exposing the individual to the drug, and that could potentially cause some problems. And we tend to think that those risks are more significant in very young and very old patients. And in this case, at 2 years of age, that's pretty young for anything. So we don't typically recommend giving medications at that age.